Well, thank you ever so much for the opportunity to present to you today about our Bevan Exemplar project, Food-Wise in Pregnancy. And due to the pandemic, we were unable to fully complete our project. However, with the changes to the way that we're all working as a result of COVID-19, this has actually presented a huge opportunity for us, as we've had to digitalise all of our community nutrition programmes, including Food-Wise in Pregnancy, in order to continue to reach communities and provide support for healthy lifestyles. So arguably this is needed now more than ever. And being part of Bevan Cohort 5 has given us invaluable support during this challenging time to be able to make this change. So my name is Lisa Williams and I coordinate a community nutrition programme in Wales called Nutrition Skills for Life, and it aims to build community capacity to support healthy eating. And we do this by providing accredited nutrition skills training, resources and practical support for staff from health, social care, education and third sector organisations, and for community peer leaders and volunteers, so those who really know communities far better than we do as professionals, and enable them to encourage and support healthy lifestyles. So as we know, well, 61% of adults in Wales are above a healthy weight, including 25% of adults with obesity. And we know that 1 in 4 to 5-year-olds start school each year above a healthy weight as well. And these rates of obesity are predicted to increase to 64% of the population by 2030. And we need to change this trajectory. So the Healthy Weight, Healthy Wales strategy, launched in 2019 and legislated through the Public Health Wales Act, commits to ensuring that the people of Wales and our future generations have the best start in life and live longer, better and happier lives. It's also well documented that giving children the best start in life is crucial to reducing health inequalities across the life course, and that foundations for virtually every aspect of human development, physical, intellectual and emotional, are laid in early childhood. What happens during the first 1,000 days from conception to 2 years has lifelong effects on many aspects of health and well-being, from obesity, heart disease and mental health to educational achievement and economic status. Nutrition plays an important part in this development. And pregnancy is a powerful motivator, a teachable moment and an optimal time in life to make lifestyle choices that can positively impact on health and well-being of women and their families. And being a healthy weight in pregnancy reduces risk of gestational diabetes, high blood pressure, preeclampsia, caesarean section for women, and lower risk of childhood obesity for infants. So with our project, we set out really, we knew that women often receive mixed and confusing messages about nutrition and physical activity in pregnancy from the internet or from social media influencers giving their personal advice, or from family members hailing Eat for Two. Midwives and health visitors are often not confident to raise the topic of weight and have limited time to talk about healthy lifestyles during routine antenatal appointments. And working with midwifery and health visitor colleagues and Flying Start families in Cardiff and Vale, we developed a 6-week healthy lifestyle and pregnancy programme, Food-Wise in Pregnancy. Dietitians train community workers to deliver the programme, providing a more cost-effective model, with support workers and assistant practitioners working at the top of their licence. And through our early discussions with Helen and Sean in the Bevan Commission, we were encouraged to consider a more peer-led model rather than a professionally led approach, and to include a greater focus on physical activity. So our aims were to improve access to support for healthy lifestyles, to deliver the Food-Wise in Pregnancy programme, and to provide accredited training for community facilitators and also for our midwifery colleagues. And we've delivered the programme to a small cohort with successful outcomes, and we aim to test this model with more women and partners and to make recommendations for all Wales rollout as part of Nutrition Skills for Life. And you can see on the screen there, they're the 6 weekly programmes that have been developed, and an outline of a bit of the content there. So what did we do? Well, between October 2019 and March 2020, we engaged with partner organisations, with midwifery colleagues, with Families First and Flying Start, and also with families through a reunion event from previous cohort. We developed promotional resources which have the QR codes. You can see some of those on the screen there, posters and stickers that went inside the maternity handheld notes. We established a booking system for self-referral, and that was through Eventbrite, and the QR codes took people into that booking system. We trained qualified midwives in training that's accredited by the Royal College of Midwives about nutrition messages and how to raise the topic of weight sensitively and appropriately. And we delivered 3 food-wise in pregnancy programmes. We also surveyed women's views about the number and durations of sessions to see if that was right, whether we needed to make any changes there. And we also wanted to explore with pregnant women how they would prefer to access this information. As the numbers attending programmes, we knew there was a difference with this programme compared to other community-based programmes we run. The numbers were always relatively low. But we began to also think about, and little did we know what was to come in March 2020, but through the work with the Bevan Commission and meeting our fellow Bevan Exemplars, we've started to think about things like apps and things like digital technology and other things that we might be able to develop. And we knew that there was a potential cost saving with this work. We did some work with the finance team through our links with Bevan, and we estimated as the highest cost would be around £200 per person to attend the course. And we then compared this to some econometric estimates that were done by Dr. Kelly Morgan and team from Swansea University, which estimated that if the costs of delivering a prevention programme were less than £1,171, then the estimated this would be less than the estimated increased healthcare costs during pregnancy for women with obesity. So those costs from Swansea University were purely based on increased costs of care of the mother and didn't take into account the potential savings to both mum and baby through improved long-term health and impact on disability-adjusted life years, for example. So the cost savings are likely to be much higher. We also did that cost analysis before COVID and before we anticipated the digital technology and the changes that we would be going through at this time. So cost savings are likely to be even greater. So these are some of our outcomes. I won't go through all of these in details because of the limited time available, but we use results-based accountability to evaluate our programmes, to look at how much we're doing, how well we're doing, and who's better off as a result. So we undertake post-course training questionnaires with staff after training, and also post-course questionnaires with our participants, community participants, in this case, food-wise in pregnancy participants. And you can see some of the outcomes there, with really high satisfaction in terms of the number of people being trained who felt they'd learnt new information and felt more confident to pass on messages to others, and the number of food-wise in pregnancy participants who rated the course as good or excellent and would recommend the course to others. But also in terms of, crucially, who's better off as a result. Pregnant women reporting feeling more confident or much more confident to manage their weight since attending food-wise in pregnancy, and they felt they'd been able to make changes to their own diet. And some of those changes were around increasing fruit and vegetable intake, including more oily fish more often, making sure they were achieving their daily calcium requirements, and being able to use the Eat Well guide as to give them a bit more guidance on food portions and achieving a healthy, balanced diet. And these were some of the comments that we had from our participants from those 3 groups. So we knew that women learnt new information, they enjoyed meeting other people, they enjoyed making new friends, and they set up, in many cases, their own WhatsApp groups to continue to stay in touch after the group. So we really felt there were really positive outcomes and it worked. And we wanted to explore how we could enable a more community-led approach, work more closely with our third sector colleagues to foster an assets-based community development approach, so focusing on what's strong and not what's wrong within communities. And then COVID hit in March 2020, and as public health dietitians, many were redeployed towards and into the Dragon's Heart Hospital in Cardiff, and we also worked with local authorities and the Welsh Local Governments Association to support emergency food provision for people who were shielding and self-isolating, and the provision of food for families usually in receipt of free school meals so that they could continue to receive their food-related benefits. And before COVID, we had fleetingly discussed the potential for developing digital training resources, so apps or e-learning, but this seemed nigh on impossible at that time without the funding and expertise to do that. But as I mentioned earlier, COVID-19 has actually presented a huge opportunity to us to accelerate digital development of our All Wales Community Nutrition Programme. So we embarked upon our digital transformation journey, and this really needed to cover both aspects of what we do. It needed to make sure that we were meeting the training needs of our partner organisations, but also provide resources that would enable the staff that we trained to be able to continue to reach communities and deliver those programmes in communities. So we established working groups for each of our courses. We agreed our evidence-based approach to delivery for both staff and for community groups. So for staff, this was a flipped learning approach where we had a combination of e-learning courses, so the asynchronous learning and teaching, so e-learning sessions followed by that real-time synchronous face-to-face digital training to retain that sort of dietetic input and training. And for community groups, we asked partner organisations how they would like to receive those resources, and we are developing digital training materials that can be used through that face-to-face or live teaching online. We developed electronic workbooks for all our courses that are accredited through Agorid Cymru, and we've worked with industry partners that we met through the Bevan Health Hack, Fusion Digital Health, to develop digital learning content in the form of interactive games. And for Foodwise in Pregnancy, as that stopped, our third programme was stopped midway because obviously the pandemic hit and we could no longer do any face-to-face delivery. So we made some short films, some promotional films. They were very much made at home. Staff were working from home. They were intended to be engaging and informative, but friendly and approachable, and providing those main nutrition messages from the programme. And we also took the opportunity to survey pregnant women through the midwifery Facebook pages to find out their preferred method of accessing information. And 98% told us that they'd be either very likely or likely to download a Foodwise in Pregnancy app, and 85% said they'd be likely or very likely to recommend it to others. So we realised we'd need funding to completely digitalise our programme, and we applied to the Health Hack, we applied to the Life Sciences Hub, we applied to the National Lottery without success. But then in August 2020, health boards were asked to submit plans for utilising Healthy Weight, Healthy Wales funding available up until the end of March 2021. So we took the opportunity to write to directors of public health and asked if they'd consider a one-off contribution towards the cost of digitalising nutrition skills for life. And all health boards contributed to some funding towards that. And in October 2020, we secured that funding, and we were then able to progress with the development, full digitalisation of nutrition skills for life. So we got to know, I have to say, we got to know our colleagues in procurement and in NHS Wales Shared Services Partnership extremely well through the conversations then that followed. And by January, we'd awarded our first three contracts to industry partners, and this included the development of the Foodwise in Pregnancy app and teaching resources for digital delivery of Foodwise in Pregnancy groups. So since January, we've awarded a further 4 contracts for digital resources and development, including another app for our generic weight management programme for the general adult population, and also developing a website for nutrition skills for life. And all of this will be available bilingually. So next steps for us will be to build and test and refine and launch the Foodwise in Pregnancy app. You can see a little image of what it's going to look like here. To launch the virtual Foodwise in Pregnancy training resources to be used by our colleagues, and evaluation will be undertaken by the CEDA Evaluation Centre to monitor impact and to make any changes post the test phase if needed. And then for Nutrition Skills for Life, we're also looking at developing the e-learning content, digital teaching resources for our other level 1 courses, and a second app and a website. So I just wanted to take the opportunity to say a massive thank you to everyone who's been involved, and I've listed everybody here, and so particularly to the industry partners, Health Creative and Fusion Digital Health, but also to the Bevan Commission for their continued support for this development. I would say in terms of our experience of change, communication's been key to engage public health dietetic teams and our partner organisations in these developments, and with industry partners to keep on track with delivering on contracts. It's been a really exciting time for us, and it's seen a complete transformation of our programme to digital delivery. And considering this is such a big change, it's been really well received by staff teams across Wales who have worked really hard to make this happen in a short space of time. We're still on this journey with much to learn, and it's been a really steep learning curve and at times overwhelming. However, the support from Bevan has given me greater confidence to drive this forward, and we may not get this perfect first time, but we're determined to work with communities to keep people at the heart of what we do. And being part of the Bevan Exemplar projects has been a fantastic opportunity. It meant that we were ahead of the game with digital developments, as we'd already started to build those connections with industry partners and with procurement, with Agor IP, for example. So I'd really like to thank the Bevan Commission for giving us this opportunity, for believing in us and our project, and for all their support during these really challenging times.